Hi, everybody. This is I'm going to record this as opposed to present it. I'll probably do it in two sections. I want to do a brief piece on endocrine, and then I'll get set up and do a larger component on, how shall I say it, on the general cardiac anatomy. I'll show you which PowerPoints are going to be included in this. I'm starting with this one, which is chapter 15A. Okay. And I have to recall where you would find, you'll see it, and I'll let you know where to find this. And as well as the next one, this is just the basic endocrine one. And then chapter 17A, which is really all about the heart anatomy. And next time I would like to do two things. The presentation on the conducting system in the heart and what it means to the electrocardiogram. And then after that, uh, or I'll do that in sort of simultaneously with doing the dissection of the heart. So it'll be let's say a much busier. Hopefully the weather will be conducive. Not that the weather was a problem today, but it might have been, and that did affect a lot of students coming in. So many of us had classes that were, relatively speaking, sparse, and that's probably why. There were quite a few of us who were doing these things online, but nevertheless, let's get started. So the first thing I can show you, I just want to double check, make sure everything is recording, and it looks like it is. So that's all good. Is here with the endocrine system. Now, endocrine is something that you're going to probably cover in more detail. Particularly, to me, it's a very physiological system. There's not a lot to it. And really, it works its way through a series of chemicals. Effectively, you have two major control systems in your body: the nervous system, which we've dealt with both last term and to some extent this term, and probably that's what you started with, which is rapid responses. You see something with your eyes, you react to it. The anything you have to grab something, you go and grab it. You do, yeah, all of those we do in fractions of a second. When we have things that are constantly being regulated either upwards or downwards, and it's a term you hear a lot, upregulation and downregulation, either going to be a system be more active or less active. It's typically done, and the duration of its effects are longer by way of the endocrine system. Now, a brief definition is, and I'll point that out in this PowerPoint: endocrine versus exocrine, which is sound similar but hardly are anatomically. Endocrine, and this is why it's not really an anatomical system other than identifying the glands, is a series of organs that produce secretions. They give off chemicals in liquid form immediately and are surrounded by a capillary bed, by blood vessels. When some of you might have seen it on the brain dissection, that there were lots of little bits of blood vessels. And if you had a brain that had the outer coverings on it, would had some of the meningeal layers still, you would have seen a dark nugget on the inferior surface, close to where the optic chiasm was. That was the pituitary gland. What that big darkened area was the nest of blood vessels, the big capillary bed that surrounds it. So endocrine, the capillaries almost act like a sponge, suck up the secretions, and they're rapidly, relatively speaking, distributed. Not as fast as nerves, but something that goes into your bloodstream in a matter of seconds. If it's something that's very fast acting, will have an effect. So if someone gets an intravenous medication for pain, okay. If you ever seen movies with people with drug addicts injecting themselves, it doesn't take long to have an effect. And so the endocrine system works fast, but not nearly as fast as the nervous system. The agents are called hormones, and by definition, they travel by way of the bloodstream. There are a couple of variations of these that act more locally. Okay, they're called autocrine and paracrine. So they're secretions that are released but act on either on neighboring cells or even on their own cell. That's an oddball. We certainly see it in the immune and digestive system. And when you get to that in physiology, you'll probably talk about it. We'll probably talk about it a little bit here when we do digestive as well. So we're talking, it could be as little as seconds or as much as minutes or hours, or even days of duration. Anything that takes longer to act sticks around longer. Slower response time, longer duration. That's very, very consistent anatomically and physiologically. So we look at the hormones that produce, that's all physiology, and the organs themselves, that's the limited anatomy. And I really don't spend a lot of time looking at the microscopic anatomy because they look very similar. I mean, you have cells within a given organ, whether it's a pure endocrine organ or just a partial endocrine organ. And those cells secrete materials that basically are excreted and are sucked up by surrounding blood vessels. There's not a whole lot to it in that regard. There are some subtle nuances, and I'd like to say when you take a look at the thyroid and lecture, you'll see all the fluid collects like in a central area, and it makes something called globulin, and then all that fluid has to be processed with iodine to finally make thyroid hormone. So it's a little bit different. Each one of them has different anatomical setups, but they all basically work the same way because really you're going to see it's kind of a limitation as to what it's made of. Okay. And we'll see that shortly with the constituents. And again, this is more physiology, but I want to touch on it. So, I mean, here are the big differences: tabular, fast versus slow, duration, short versus long, hormones versus neurotransmitters. Uh, the nervous system is very specific what the nerve attaches to versus here in the bloodstream. If the thyroid gland secretes a hormone, it goes all over the body, and most of the cells respond to it. So it can be very long distances, where nerves it's inevitably very short distances. And you can see all of the things that they work on, all the different systems. There's a lot. So exocrine, if you think of a sweat gland that you looked at when you looked at the skin, or a salivary gland, which you're going to look at when you get to digestive. They have a passageway called a duct. It sometimes leads to an opening like the mouth or to your skin, or you're going to see even in the digestive, we're going to have an organ like the pancreas, which is on the inside, is exocrine, has a duct that opens up into your alimentary canal, your digestive tract, to help with digestive juices that help to digest things and facilitate their absorption, versus on the exterior of that gland is surrounded by blood vessels that secrete a very, very famous hormone called insulin and a hormone that works opposite it called glucagon. Go figure. But what that does is it provides something that we see a lot of in the endocrine, sort of in the endocrine world, is things that oppose one another. And so, and the term that this textbook uses, which is pretty good, I think, is called dynamic antagonism. It's like a push and pull. They're tugging on one another and getting things, not only getting things done, but getting them done very precisely. So, like with insulin, the glucagon makes sure that you don't go every time you eat something, your sugar doesn't. Every you eat something, your sugar goes way up because most of the time you have some carbohydrates in it. The insulin is released and immediately drops the sugar down. So theoretically, you'd have very sharp spikes and troughs. It would go up fast and go down fast. But the reality is, it's a lot smoother. That's where the glucagon comes in. Sort of softens the blow, if you will. So that's the idea between exocrine and endocrine. So the major ones that we'll look at anatomically, and I'll show you in the diagram, very, very illustration rather: thyroid, parathyroid, adrenals, and the pineal gland. The oddball here is the adrenal gland. The adrenal gland is a big mass, not big, but it's a mass that sits on top of your kidney. And the inside of it, if you remember from AP1, involves the adrenal medulla, which is really a ganglion, really a crossover station of the sympathetic nervous system. And then the output from that ganglion very quickly goes into your bloodstream. And that's kind of why they look at it as it really is an exocrine gland, because if you recall, the epinephrine and norepinephrine that comes out of the adrenal medulla, the interior portion of the adrenal gland, is really acting as a hormone all over. And it goes to lots of different organs and has different effects. Whereas the external area of, which is called the adrenal cortex, the outside, so to speak, of the adrenal gland, is releases what are called corticosteroids. Cortico because it comes from the cortex, steroids because they're based in cholesterol, and those are a really potent group of very important hormones that play a pivotal role in immune system and water balance and electrolyte balance, and also produce a certain amount of sex hormones in the form of androgens. And interestingly, in women, this is the only area where we have androgens or testosterone-like substances that are produced, and so they do play an important role in red blood cell production because it stimulates red blood cells in women, and certain important effects that are associated when you get to reproductive physiology of those androgens. Things like sexual development and certain aspects of it that work in concert in women with estrogen and progesterone. So you can see there's a couple of double duty ones. Pancreas, which I commented on. Hypothalamus is neuroendocrine because it means it's really part of the nervous system, and its endocrine secretions that go in the bloodstream are actually neurotransmitters, but they're still hormones, and you'll take a look at those. Other tissues and organs and now a quick word on the gonads and the placenta. These are reproductive structures. Okay, placenta specifically takes over producing estrogen and progesterone in women during pregnancy, so it takes the place of the ovaries. The ovaries and the testes are double duty. They're exocrine when they produce eggs and sperm, but they're endocrine when they produce estrogen and progesterone and testosterone. So there's something like double duty. They have a dual role, just like the pancreas does. And there's a variety of others. And again, you get most of that in physiology. This is the diagram, as it were, illustration. So here you can see, be it male or be it female, depending on which side you're looking at, it's a male figure, obviously. You have the testes, and if this was a female and didn't have the external genitalia, you'd have the ovaries that are there. And all the others are what you're going to learn are accessory structures. Here's the pancreas. It's nestled sort of behind the stomach and sort of like in the crook of the start of the small intestine over here. And the pancreas, like I said, on the outside, surrounded by blood vessels. Cat's making noise. And on the inside, it's the end as the exocrine function. There's a long channel or duct that leads into the small intestine with digestive stuff. The kidneys, even though they have some limited endocrine function that you'll see when you get to the physiology, and you might have, you'll touch on it in the bloodstream because they make something called erythropoietin, which stimulates red blood cell production. Here are the adrenal glands. And again, the interior really are part of the sympathetic nervous system, the medulla, but that exterior portion is the cortex. Thymus, very, very small, particularly in adults because it shrinks from when you're born. And that plays a role with hormones that help to activate really the very important part of what's called your adaptive immunity, which are T cells. And the T, as you might guess, stands for thymus. Parathyroid, you can feel it on either side of your Adam's apple. Soft and fleshy. It's a rather good sized gland, but the parathyroid glands are somewhat on the back. You really can't feel them. They're sort of nestled against your trachea and the digestive and respiratory passageways, and they're like little nuggets of tissue that are different. They're usually paired, top and bottom on each side. Usually there's four. There can be as many as 8 little nuggets of parathyroid gland. They're not the same. They don't produce the same thing. So it's 2 glands in one location. And then here in the brain, really, and the master gland is what it is, the pituitary. And interestingly, its anterior portion is a true gland that's an exocrine, a bigger part, an endocrine gland. And the posterior portion is really a little portion of the central nervous system. It's a portion of the brain in the form of like a little tail of the hypothalamus that protrudes down, called the infundibulum. And out of that emits a couple of neurotransmitters that go throughout the bloodstream, famously oxytocin, which we make genetically. It's called pitocin, and what it does is just it induces labor. The same thing. It's relatively simple to make genetically. There's only about 9 amino acids long. And the other one is called vasopressin, or antidiuretic hormone. That too is made genetically. And it's utilized for a lot of things. One of the things it happens to be utilized for other than to supplement people who aren't making enough of it, is particularly people with certain kinds of bleeding. A lot of people have bleeding disorders that are difficult to treat and sometimes are worse during surgery. And the reason I know about this is my first wife had a condition. She had a variant of what's called von Willebrand's disease. And a lot of people have variants of it. It's more common than you think. So it's not that unusual, but it affected her clotting, particularly when there's significant trauma. And she had a substantial internal bleed back in 1981 when she was having ovarian surgery. They were doing what was called wedging ovaries. It was an effort for her to get pregnant, which was unsuccessful, but that's not the important part. The important part was that they discovered she had a bleed, had to have a transfusion. And then we went back to the blood bank for blood tests, and they found out she had this variant. From that point on, whenever she had to have another surgical procedure for anything, she had to have be an injection X amount of time, a couple of hours, 6 hours, I think, before or the night before, the morning of a surgical procedure, or even a dental extraction, like getting a root canal or having a tooth pulled, was something that she would have to get. This was called DDAVP. DDA stands for the genetic basis, and the VP stands for vasopressin, which is the name. And then, so those two are intertwined. And then behind back here, you might remember from the brain dissection, there's a little gland that looks like a pine cone. It's called the pineal gland. It's really more a gland than a central nervous system. It secretes melatonin, among some other things. It has to do with regulating body uh, timing issues, sort of the rhythms we call them that your body has. So again, hormones might just be a long distance, but typically they travel through the bloodstream and lymph, which is a different circuit. They're certainly carried in the lymph. It's not that that's the normal channel, but they do end up there depending on where they're coming from, particularly digestive. And autocrines, which actually work on the same cells, so they really don't go by the bloodstream. And paracrines, which work on cells in the area, and again, probably not through the bloodstream. So they're a little oddball. These are the two big categories: amino acid versus steroidal. Amino acids, since they come from proteins and amino acids, they're water soluble, not fat soluble, except one. And the big exception to this is thyroid hormone. Thyroid hormone is made of two identical molecules of an amino acid called tyrosine that's sort of flip flopped. One's upright, one's pointing down. And they stick iodine on it. And because it's so symmetrical, the molecule, it's and it's not terribly big, it's fat soluble. So it acts like a steroidal or a fat soluble hormone, even though by definition it's not. The steroidal ones are all made from cholesterol, from either estrogen, progesterone, or the three that come from the adrenal cortex, and they work differently. These work from the outside of the cell by that G protein passageway. So they attach to receptors on the outside and trigger a chain reaction on the inside. The fat soluble ones can get through the membrane, steroidal ones, and the aforementioned thyroid hormone, and actually contact receptors in the cytoplasm and then form a complex that goes inside, okay, the nucleus and directly affects transcription and translation. The eicosanoids are something you really look at when you do the immune system in lecture, and what it talks about are these local chemicals. Okay, they really are paracrine. They play a big role in inflammation. When you take an aspirin or an ibuprofen, the way it works to slow down inflammation is through these. In the old days, they were first discovered and named for where they came from, which was interestingly, okay, prostate. They found them in secretions in the prostate gland. I always wondered what they did. We know what they do, but they named them prostate gland stuff. So they called them prostaglandins. But they find out they're all over little local signaling compounds. Really, probably not in the realm of endocrine. And they're very, very specific. So some like thyroid hormone, nearly all cells are a target. Where uh, when you're talking about follicle stimulating hormone, it specifically target follicles, which are only found in women in the ovaries and in men in the testes, making eggs and sperm respectively. So all of these things, what they can do, alter the membranes, stimulate synthesis like growth hormone, activate enzymes, induce secretion, stimulate reproduction. And again, the categories either water or fat soluble. And again, the oddball is the thyroid hormone. And again, this G protein system, the first messenger is, let's say, the insulin. The second messengers are what goes on inside the cell. And they show you this. And we're not going over this. If they want to do it in your lecture, it's fine. Here's the first messenger, let's say it's insulin, setting off a chain reaction based on these it's called G protein receptors or G passageways, because the big G stands like an A, TP stands for adenine, this one stands for guanine. And they're very, very similar. They're both purines. So they both have similar activities. And it goes all the way through. And now the second messenger is typically either calcium or the cyclic AMP, where they breaks down, takes a couple of phosphates off the ATP and changes its shape. And they go through a whole thing you don't have to know, and you don't have to know, and you don't have to know. And if they want to do it in lecture, for me, you certainly don't have to know. And here's one where it works its way through. It comes in, it complexes, steroid gets through, complexes the receptor, gets into the nucleus, and directly affects transcription and translation. So that's the other part. And if they want to show you that in lecture, that's fine. Mostly it's negative feedback. There's some limited positive feedback things. And I think that's everything without getting into specifics. So you'll see all of these. Then when they'll do them gland by gland. And to me, that's very much of a lecture. Here's that. Well, I didn't mean to gloss over it. It's like looking at the back of the thyroid. Those little nuggets here, 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 here. And usually there's 4, and there can be a couple more. Just depends. Not a big deal. And this is thyroid. And you can see they've represented in different colors because they are different. Even their internal structures are different glandularly, microscopically. I think that's everything. Again, they work by up and down regulation, more active versus left active. You can physiologically grade them from seconds to hours, how long they are active. All of this stuff is part of it. So I don't think there's a whole lot as I go through the rest of these here. To me, this is all physiology. We're not going to get into this elaborate capillary network. This is the posterior pituitary as it comes down. And it's also called the hypophysis, HYPOPHY, and the network of blood vessels is capillary bed here. So whenever you have two capillary beds that interconnect, it's called a portal system. You'll see that in the digestive area. And here there's lots of sensors in the hypothalamus, and they pick up signals in the bloodstream. And effectively what they do is they either tell this to secrete directly neurotransmitters like antidiuretic hormone, based on how concentrated or not concentrated your blood is. And they also have a variety of hormones that signal the anterior pituitary to get busy or to slow down. And we call those release hormones, get busy, or inhibitory hormones, slow down. And these are the ones that are directly released, oxytocin, ADH. Again, that's much more about lecture than lab. And the disease that has to, when you don't make enough, is called diabetes insipidus. It's not diabetes that you hear so much about, which is also known as sugar diabetes or diabetes mellitus. Diabetes means the great thirst. So insipidus has to do with diabetes, and it's characterized by urine that's very salty, whereas the urine is very sweet because we can't process sugars in diabetes mellitus. In the old days, salt and sugar diabetes used to be a very tough time treating this. You had to really restrict fluids and lots of problems with electrolytes. Now we make this stuff genetically in the laboratory, so it really helps out. So I'm going to stop it here because this, to me, once you get into specific hormones that are made, is all about lecture. So thanks for that one. I'm going to stop, and then I'll produce a second video that I will send to you and post as well on Blackboard about the heart in preparation for our getting together next week. Bye-bye.